Hello everyone, in this video we are going to discuss about pharyngeal arches, pharyngeal pouches and pharyngeal clefts. So pharyngeal arches, these are derived from both mesoderm and neural crest cells. There are 5 arches: first arch, second arch, third, fourth and sixth. Fifth one is not yet formed or either formed and regressed. Fifth one doesn't exist. Only sixth arch exists. 1, 2, 3, 4 and 6. First arch, the nerve is mandibular nerve. The muscles formed from this are muscles of mastication and mylohyoid and tensor tympani. And the skeletal muscle structures which are formed are maxilla, mandible, malleus, incus of the ear. Malleus incus bones of the ear and maxilla and mandible. So these are generally mnemonic we can remember is for these are generally for chewing. Like muscles of mastication is involved and also maxilla and mandible is formed from this. Second arch, the nerve is seventh nerve, that is facial nerve. The muscles are obviously facial expression, muscles of facial expression, stapedius and stylohyoid. The structures formed are styloid process. So these are generally used in smile. We can remember with the mnemonic of smile. So muscles of facial expression. These are formed by second arch. Third arch is supplied by ninth nerve or glossopharyngeal nerve. The muscles are stylopharyngeus. Here the greater horn of hyoid bone is formed, and this is also used for swallowing. The fourth arch, it is supplied by superior laryngeal nerve or 10th nerve. Here pharyngeal constrictors like and cricothyroid muscle formed from this, and thyroid cartilage is also formed from this. These are also used in swallowing. Sixth arch, it is supplied by recurrent laryngeal nerve. The nerve which is formed is recurrent laryngeal nerve, 10th nerve. The muscles are laryngeal muscles except the cricothyroid, because cricothyroid is formed by fourth arch. Here the structures are arytenoid, cricoid, laryngeal cartilage. So these are generally used in speaking. So we have to know that pharyngeal arches are embryonic structures which are appeared on the either side of the head and neck during the development, generally starts from week 4. So these are the building blocks for muscles of head and neck and also structures within the head and neck. So next one is pharyngeal pouches. First pouch is the derivatives of first pouch are middle ear cavity, eustachian tube. So you can remember by the mnemonic of ear. Second pouch is palatine tonsils, and so mnemonic of tonsil. Third pouch is thymus, and important to remember is inferior parathyroid is formed from this structure, not the superior parathyroid. So and fourth pouch, here superior parathyroid and C cells of that is ultimobranchial body is formed. So 1, 2, 3, 4 pouch. First one is for ear, that is middle ear cavity and eustachian tube. Second is for palatine tonsils. Third for thymus and inferior parathyroid. Fourth one for C cells and superior parathyroid. Next one is ectoderm. Here that is clefts. There are only one cleft, that is first cleft derivative is the external auditory meatus, that is ear. Only cleft, this is the only cleft that persists. Second to fourth clefts are normally obliterated as before birth. If persistent after birth, so we have to see in this diagram. First one, this middle one is the pharyngeal arches. These are formed from mesoderm and neural crest cells, and on the anterior side these are the clefts. These are ectodermal derivatives. The posterior, these are the pharyngeal pouches. These are endodermal derivatives.